Good afternoon. My name is Kelsey DeClue. I'm with Columbus Regional Health, and I want to thank you for the opportunity to give you an update on our response and continued work on COVID-19. The first thing I'd like to talk to you about today is that we continue to plan for what we call an impending surge of potential inpatients with coronavirus. And this work has been happening within our health system for several weeks. However, we have been able to have access to some national models that allow us to project what our patient population for those individuals needing hospital care, hospitalization could be over the next few weeks. And from those models, we're seeing that influx of potential patients is still forthcoming and likely won't hit our community until the end of April toward early May. And so what does this information mean and why is it important? Because, I think we've all heard the term physical distancing, the term social distancing so much that we're probably saying it in our sleep. But models like this that inform what our patients could be dealing with in a few weeks, which is even more so than what we've seen ramping up from the beginning, just makes that action so much more important. And again, it's an action that each individual, each community member can take upon themselves to continue practicing those physical distancing guidelines, social distancing, and staying home. We know it's hard. We're all observing this ourselves. We know that we're going on week 3 of these formal restrictions for the community, and it's rough. All of us are dealing with multiple stressors in our lives, and COVID-19 is driving a lot of life changes for all of us. And it can get really, really tough to stick with it. So I just want to let you know that we are with you in that frustration. We feel your pain. We know it's hard for the community, and we really appreciate your efforts so far, because these efforts directly affect our frontline clinical workers that are showing up every day, that are preparing to care for the increase of these patients. And so it's really, really important. Your work is for them, and they're working for you and for our patients. So our continued teamwork is so important. That being said, we know it can be mentally taxing. It's really hard to give up some of those things that we used to enjoy in life, especially seeing loved ones up close and not having to just do that over the phone and being able to get out and travel places. We know that's hard. And so there are resources out there. It is perfectly normal to feel a sense of stress during a time like this. And you're not alone in the way you may be feeling if you have those feelings. There are plenty of resources available, and we're going to provide those on the task force webpage and the social media page. So if you aren't already, please follow us there, and please check the website for those updates. One I'd like to call out for you is a local resource through Family Service, Inc. So if you're looking for a therapist, if you're looking for someone to talk to, if you're looking for help with some parental issues, I know a lot of us in the community are e-learning right now. The kids are home. They're just as restless as we are. Please reach out to Family Service, Inc. And that number is 812-266-0575. And again, we will have this information for you on the Facebook page and the website. Lastly, I'd like to, again, just send a special shout out to all of our workforce members, our physicians, both on the hospital side and on our physician practice side, medical professionals, nurses, techs, those in housekeeping, environmental services, and also the great partnerships that we have with our area first responders for all of the work that you are doing, for your continued dedication to this, to your patients, to this community. Please know that you are appreciated and your efforts do not go unnoticed. I'm the public relations coordinator for the health system, and I receive so many accolades on a daily basis for what the Columbus Regional Health staff and providers and physicians are doing, and just want to pass that along to know that your community appreciates you. Again, this has been the latest update from Columbus Regional Health, and we'll have another for you on the next webcast. Thanks so much.